I would like to thank Professor Azad, Anand, and the entire executive and IROP for giving me this opportunity to deliver a oration which is on the name of a legend in ROP. You know, this particular photograph was taken during World ROP Congress in Shanghai, and I was one of the judges among four, you can see there, for the posters in that very session. You also see there Shapiro, Michael Shapiro, as well as Kondo, who came last time. And I think we've been very fortunate. I think Subhadra did a splendid job by inviting him, especially into LB Prasad, where this workshop was held. And how hard a person can work even at that stage, he had shown to us right from morning till late. And that is the time we all, you can see quite a few of us there up in that photograph. And we are all aware, the group here, we know that retinopathy of prematurity is a new problem, emerging problem. And we also understand, and that is what we have contributed probably significantly from this country, I'll come to that the higher birth weight babies are developing ROP in all the developing countries, not only in India. And it is becoming a major public health concern. And the best part is the blindness is, preventable in majority of these cases. I think these are the figures. That is what Anand alluded to, the first two studies, back to back. One from Lingam Gopal, another from us, from PGI. This was in 95 IGO. And that is where the whole thing started. And the incidence was somewhere 38 to, in their study, and 47. Our study was prospective. And that is what perhaps it was as a first thesis I had given to someone. And that's why I think it has, I was surprised. I'll talk to you about that later. And these are the numbers. These are the recent Lancet Globe Health. Talks about in terms of 490,000 preterm infants born before 32 weeks of, and 5,000 need some form of treatment for ROP. This is for our country. That is the way it has been put forward in this particular article. I think why I say Professor Azad is here, I think his contribution immense. I'll come to that later. Why I say this gentleman here, Lingam Gopal, is father of ROP. He started first of all somewhere in 1990. He started, and he came the same year to USA, and I was doing fellowship. And I already used to go, and he told me you concentrate more. He started seeing, and he even told me that the lady who heads the Child Trust Hospital is also trained from PGI as a neonatologist. So you'll have maximum number of babies there. So I understood that. I concentrated, and I started working in 1991. That is the time I started my ROP work in PGI Chandigarh. And you see, we grew over the ages. This is in a ROP session in Agra. I think Subhadra and others would remember. I think we had a full hall. People were standing. We felt so good. And 95, this is the year we published, both of us, Anji. So I had gone to Chennai there, and even Tarun is there. Well, I think we owe a lot to Professor Azad. He changed the whole scenario. He brought it onto the national front. I can tell you where we were. I still remember my first presentation sometime in first Congress, when somebody got up in LV Prasad, this senior gentleman, that why you are wasting young men. I was young that time. So I said, sir, this is coming. Because we used to have retrolental fibroplasia as differential diagnosis of retinoblastoma. That was it. That is what we learned, and that we know it. So, but then, I think Harsh Kumar, I have mentioned here, he doesn't do ROP now. He started, sir has gone those days to Kuwait. So he was doing work there, and he took up in RP Center that time. And he was even involved in the first book which he wrote along with Professor Azad and Michael Shapiro. And this was subsequently when I visited RP Center. You can see there Parijat, Rohan and others. I visited their team. I think that is where it started. When he started having pair peer workshop all across country, and this was first in the RP Center in 2001. And you can see here, Subhadra is there. We are all young, and many of the faces you can recognize are there. I think subsequently, a lot of work. I think Narendran is here, Parag with him. They started both of them in 2000. And they have done a remarkable job and remarkable work in this area. And so you see here, of course, Anand and that's their Parveen. I think Parveen and Parijat, they are stuck up in the course, which is being conducted by Professor Atul Kumar. They are sitting right on the stage with him, so they're not even here. And of course, I think Subhadra does all the credit. She, in fact, has infused so much of life into everything as far as ROP is concerned. So this is what I was talking, the first two studies, and why I mentioned this, that our study. You see, when I was going through, since I was given the Indian contributions, that how much impact our studies have done. And it was surprising to me that out of all the studies which I mentioned here, our study has second best citations. This put in more than 100 for this particular study, because this was prospective. I think since Gopal's study was retrospective, that has fairly less, almost half. But Anand did this last study. This has caught up quite a big Hungi et al. This is in the rural area. This has caught up a lot of citations, and that is what I think only with the citations we are contributing perhaps to the entire nation. I think this is one article. I think this was Subhadra's idea, I still remember, which has got a lot of citation, more than 100 citations. And this particular article, where all of us were, you can see here, Professor Zad is there, and of course, I think both Raj and Harsh, they are not doing ROP anymore. They moved to other area. We are still there. I think I couldn't believe myself. Anand is so lucky. This has the maximum number of citation on any ROP article written from India. This has almost so much of citations, which is unbelievable. I couldn't imagine. This has been cited everywhere. So Scopus even has more than 100, and Google Scholar has something like 194 for this particular article, which is amazing that so much has been. And I remember when this article was published, after that there was a study done by Beijing people, they talked to us, by Brazil people, as well as by Indonesian people. So many people did studies after this. And of course, you know about this article, that is where the whole thing started, that 16% were more than 1750, 6.5% more than 2 kgs, and even 22% were more than 32 weeks. That is where we started questioning those guidelines. But you see, here we have this 2 article here. Of course, we published first on aggressive posterior ROP on 2009. This was also one of the first publication we did. And this Subhadra's article about twin cities, this is a landmark article, and so is this aggressive posterior ROP from Narendran and Prakshav's group. I think you remember, if some of you remember, I think this was in the World ROP Meet in 2000 when Dr. Foster entirely based his talk on this article. Entirely based. It was so important. So I think we changed the whole thing. That's what happened. You can see the birth weights here as compared to the Western worlds and the period of gestation. That's how they started trusting us, believing us. They were saying we have gone crazy, perhaps. And look at this article by Subhadra. This has a lot of citation in American Journal. This had made a big impact because that is where she talked about changing or modifying the all the and this one again from Narendran, their group, which talks of bigger babies, and our article that time in aggressive posterior ROP, we first time had shown in 2009 in Retina that there are a lot of babies with higher birth weight babies. And this is that article. You can see here the 1572 grams. in their series, which was published in Archives of Child Diseases. And this was the picture in that. I remember when he had shown this picture earlier to me, they had not written this article. And I mean, it was unbelievable. There are no vessels there. I have not projected, I don't have that. And they have shown with anti-VEGF and subsequent laser, this went to favorable outcome. And they had first time brought out this unblended oxygen as one of the major factor responsible for this. So how it helped us, all these studies? It helped us changing the guidelines. I have just put the American guidelines here. If you go through the entire guidelines, they are everywhere they are different. So we could make it 2 kgs in 34 weeks. If we don't have evidence, the biggest, all of us are sitting here, the objection comes from our neonatologist pediatrician. They don't want, they feel that too many babies require screening. I think I must congratulate Subhadra for giving this the Roshni ke slogan, 30 days, people would remember it easily. And this is something which is very, very important. And all of us, we know, all of us sitting here are ROP expert. So I'm not even talking to you guys about these things, that we screen always screen the NICU. That's how you get to know them. That's how you get to know what you're going to counsel them. And that's why it's so important. And of course, I think these things have been talked, and we are trying to look at these things more seriously. And I must here talk about this kid drop model. And this is another article, I would say, which had made a major impact. Out of all the articles which Anand has written, as far as this program is concerned, this has the highest number of citations. And you see, this made a huge impact. Here, he is talking in terms of trained people. Those you train people, you train the technician, and they would screen, and he had shown high sensitivity, specificity. And of course, subsequently, the numbers have gone much more higher. And this kind of work, which he has done all over Karnataka, is a landmark work, is being replicated, not only in our country, many places, but in some other countries. Of course, we know about the treatment. I'm not talking about that. I'm not really going into that. The question is, I'm just going to be talking about what we contributed. I was trying to fish out some older pictures. You see, that is the way we did cryo. This is the cryo. I did first cryo, I still remember, when I did in October 91. And I think it was effective. Despite this nerving and all that, I remember this girl now. She has now grown, and I think she's got married, and the vision is still, she's a high myope, but vision is still 6.6. So that is the way. I think we did a good job even with those cryos those days. And of course, now the laser is the standard, and that is what, and the way we started also, I remember it is very difficult. We had to acquire one diode laser for our center in PGI. And in government sector, there was no diode that time. And they would say, they need a benchmark, otherwise the government doesn't allow you a laser. I still remember, and this exercise was going in around from 95 onwards. And it took me 2 years, till 97 when the first diode came, because ultimately they accepted some international benchmark, then only it could come. Then that's how we started. Because that time it was strictly no, that you have to only use diode laser as far as the treatment of ROP was concerned. I think when Anand was with me there, we also learned that we could treat through the wall of incubator a highly unstable baby. And this we have shown many times, and even screen through the wall. I think this has been a big contribution. That is what I say. Now everybody uses the same laser. This is a 532 laser. But how do you convince? If you don't publish, I think then it doesn't work. You need to show convincingly in a peer-reviewed, and that's why even for contribution in this June issue, I had told specifically my team here, and both of them are here, and I told both Diksha and Simar as well as other people that let's collect our own cases and put that. so that people believe that in large number it is sort of working very well. That's why we published in that. Apart from that, of course, 2010 article, which Anand is also part of it. Of course, all this is known to you. We do confluent laser. This is from the diode time picture. This is the green laser. That's how the green laser marks, and it works equally well. I think, again, Subhadra does again a lot of applause for getting all of us into this, and it was very important. I still remember, this was a World ROP. I think Narendran was part of that. When we were in, I think, World Congress, maybe in Berlin, yes. Most of the European, it was full hall, we got very good response. They said, how come you can do without general anesthesia ROP treatment? So it was an eye-opener for them. And once we showed so many cases, this is first time they could not imagine. And for us, if general anesthesia has to be given to each baby who's so sick, it is not possible in this country. So I think it gives a lot of insight, and most of us sitting here, we are there. And another issue, most of our cases, outbound, we had already seen, they were APROP. And overall also, perhaps 50% are, or around that, 40 to 50% are APROP in this country. Whereas the Western countries, they don't see APROP. And not only that, we have a problem. We don't see any APROP from our own center in PGI. We have not seen in years. But we see, that is what they are seeing every day. Whichever baby is coming for treatment is APROP. I think many of you would concur, and that is all coming from outside. That's where the problem, so we need to know more about this. So the problem is, they don't have that favorable outcome. In our own series that time published in 2009, we had 71% success rate, because all kind of cases come there. And I think that is where we have, I think, contributed significantly to the world literature. Because I still remember when many of the people, they talked from Western countries, they said we see very few APROPs. So they were not able to raise larger series, except the one series, which is from the Michael Trese's group. They published, in fact, in 2010, 1 year after us. So they were not seeing that many. So I think you can see we have quite a bit of contribution as far as this part is concerned. And that is where, again, you can see, even in APROP only, I have shown that chart in a different way later, but look at the weights. I wanted to look at their birth weight and period of gestation. So different. This is Michael Trese's group only. Dressner is working, they're working together. And Azuma is from Japan. He's been also a great friend of ours and works for the Children's Hospital, Tokyo. And we also worked which cases, because so many were going unfavorable outcome. So with the posterior zone 1 APROP, or the pre-existing proliferation, or after that they go into APROP. I think we even put this hybrid ROP. This has been coined by us term, because we were not able to fit some of the ROPs anywhere. So I don't know what is the status. Anand and Parag were there, whether they are going to include some of these things there or not. But anyway, we do see different kind of ROPs. And something like this, which we can not put large loops, as if something has been stuck there, it's not a stage or anything. And this is the first publication of posterior zone 1 ROP. Posterior zone 1, we called it, some people also call zone half, because zone half, the problem remains that it doesn't say zone 1. Zone half means anywhere, anything. So that's why posterior zone 1 to me appear a better term, and this term has also been used in anecdotal, not reports, but in between by some of the groups from Chile, as well as by Michael Shapiro and others. And so this is something, when we collected this also, these cases, you can see most of them, 79% had unfavorable outcome with laser. 79%. This is first exclusive publication also on posterior zone 1 ROP. So I think we need to contribute more. That is what we want to, and perhaps these are the type of cases we see. And you do whatever, even the stretch breaks develop later on. And once there are stretch breaks, then you can't even do, perhaps surgery is also going to be absolutely dismal. It's a problem. So I think these are the cases where we need to contribute. And we need to show that we need a combination treatment. And what are the results of combination treatment? If we give anti-VEGF, we do laser and early surgery, I think many of them, they can do better. I think I was very impressed. Recently, Diksha did one such case, and the Simmer has shown me all those pictures where they did bilateral simultaneous surgery in such a situation. And I can't believe that these cases could look that good. That is the way to perhaps to go. So we definitely need to sort of move on to into that direction. I think I will make special mention of this article. Dr. Narendran, you will be surprised. In your group, this is the maximum cited article. This has got so many citations because this was a case report. This is a case report, but has more than 100 citations. And that is what even one case can make a difference. Because perhaps everybody, whosoever is giving injection, in APROP, they would quote this. They'll go to this. That is what I can also. And of course, we are very proud. I think Parijat is sitting in the other hall, that they contributed to this Cochrane review 2018. You see, this is a big contribution from our this thing group in the sense from our country. And of course, lens sparing vitrectomy is something I think we have been propagating. I think early surgery we have been propagating, and that's very, very important. I think many of us, those who do surgery, must go on to this. And you can have result like this picture you have seen many a time. Even if it looks so scary, you just do vitrectomy, remove the vitreous, cut those little bands, and you will have an excellent outcome. And of course, you can see the contribution of our own. These are all our own, right from a group from Sankar Netralaya to the Narendran's group. Gadkari, he's no more with us. He contributed so much on the surgical part. You must go and look at his article. He has done such a wonderful job. You will get a lot of insight into many things which he started. And of course, recently Parijat also published a very good series of sequential ROP surgery at the same time. I think we've been looking at some things which we feel for many years. We are putting this trocar just up to the hub and don't push it all the way. And then just if you put inside and remove it, you will never touch. Otherwise, you will touch the retina. It's long. So that is the way we have been doing. And of course, we started doing this nasal, pure in nasal, with a I must say, because this is not written or reported anywhere, even if some people were doing, I don't know. But you put infusion in the center and these two ports from the side. And why? Because how do you spare the lens? Entire retina is so much lifted, it is behind the lens temporally. That is why it is so important to do. Anyway, I think it was not showing, it's all right anyway. So you can see maybe some other time. So you see, this was a case which I would have shown a video which didn't somehow come up here. And you can see well settled retina. It was such a bad looking case if we had seen the surgery that ultimately you can see a result like that. And management of stage 5, again contributions. Look at from our country itself. I think Lingam Gopal was the first one to start this. He started long time back. He used to get totally frustrated and because we were so close, and he would say, I have started it, I can't stop it. But then that is the way it was to go about, even in that era, because very few would settle, or later on they would have issues, or they would not see. But then subsequently there are series from Shah and Narendran, as well as a recent one from Parveen and the same group. I think we have contributed a lot also. We keep on following. Contribute on this. I think especially this article in 2008, this I had given thesis long time back. She was even senior to Anand. Isn't it Anand? She was senior, your senior. And she wrote finally when she went for fellowship with I think Arvind group in Madurai, isn't it? That is the time she wrote. And it is very well cited. And of course, these kind of sequelae can happen. And you have this kind of myopia happening. I think we need to work at all stages. Work at all and contribute. That is what we need to see. I think we have contributed in this manner also here. We have this, you can see up there, you all know about NeuRet. And studies are there. And not only that, it is working very well. And if you can identify a treatable and don't miss that, I think the job is done. That is what is basically required. And even, I must say, this MI-RET, it is being used on so many things. So Ashish Sharma has been quite smart, and many people are using his device for various things. Of course, not a wild field, but then at the same time, they can make it move, and there are these published studies you can see. So I think we have a lot of contribution as far as these kind of screening devices are concerned. And we have a problem. We have a increasing ROP blindness because of the many problems which we know it, increasing number of NICU, SNCUs, ROP treating. That's what we are trying to do. All of you know that. And now already probably there are around 800 SNCUs. We don't have programs really everywhere to screen them. And these are the fertile grounds for getting, that's why we are doing all this, what we are trying to do, what we are talking, what we talked earlier. And if you see like this, that is what I keep telling, and that is story perhaps. I used to see one baby once in a while when I started this program, and then started seeing maybe once in a month, then once in a week. The story was when I was in PGI, I was seeing minimum maybe 4 to 5 babies every week with stage 5. So I think we have to reverse that. If we don't reverse that, then we have a problem. Look at this study here, done by us and Professor Azad's group, I mean, which has 86 to 89% were never, they were never screened. They went to stage 5. That is where we are, what we are talking. And majority were picked up by parents when they noticed that a child is not seeing. And pediatrician referred none to 8.7%. In one study, none was referred by them. In other, 8.7% only were referred. And even ophthalmologists, between 26 to 86% referred them, but some of them very late. So I think we need to do something. That is why such articles are very important. We have to create that awareness. I think this has already been talked about, the Queen Elizabeth Diamond Jubilee Trust. I think this has helped us a lot, and that is what is going to help us. This is 2013 to 19, which was with us, and that is where that whole thing which you are going to have exactly the way we're going to train people, the way we're going to do, has been done under this very program. And this has definitely, you can see, go through some of these things here, and it's not only for us. They have come out with great guidelines for the pediatrician, for the neonatologist. They have done a wonderful job. That is where this last publication is. And so I think you must go through these. This is in the recent article, the journal which has come out. I think we must feel proud. Something like retrolental fibroplasia, which nowhere existed, they gave us full 2 journals. One, Pediatric Retina in June, which was in IJO, and 2016, whole, you see, Indian Pediatric Supplement, they came out with. So I think we have shown and we have contributed, and we need to contribute more. I think we have now gone places. This I'm just showing that we need to bring it across to Professor Azad. He always comes up with great fertile idea, and that's how we are here today, and that's what we are trying to do. And there is something to do with PGI and ROP. I think all of us are from PGI, and that is where maybe I think it had to grow somehow there. And of course, I could do because I had great people with me, great colleagues, my teachers, and they helped in every way. Maybe we had to sit this way only. the way we were, right? Professor Jain, who was our head, then Samod Gupta, Professor Jagat and me. So I think I'm just concluding that we have contributed significantly as far as the ROP is concerned, but we need to contribute more. We definitely need to contribute more and contribute in a way which is relevant to our country. And at the same time, try a prospective study. If you do that, I think it has a major impact. And if you do something which is relevant to us, that is how Professor Anand's thesis in this article is the most cited, because of that we looked at problem which we had and which we found most difficult to publish anywhere. And finally, as a desperation, had published in Indian Journal. So I think we need to look at, and we need to somehow do much more, and which perhaps our society is doing. Thank you very much. Thank you. Thank you.